Today I am presenting my patient case file, digital report dashboard. The purpose of this dashboard is to convert a traditional paper based hospital care sheet into clean structure and interactive digital format. I have designed the dashboard in such a way that essential patient information appear clearly on a single page, allowing a doctor or a reviewer to understand the patient case within a few seconds. The first section display here that includes patient's name, age, gender, admission number, the day of admission, the day of discharge, the sum of the uh, stay duration. These fields are placed at the top because they are the first element any clinician or a doctor needs to verify when they are reviewing a case file. I have also included the length of the stay, ICU uh, duration because they are also important indicators of the severity and the hospital resources utilization. Presenting them in a simple numeric form because it maintains a clarity and avoids unnecessary visual distraction. Moving ahead, I had included a section of smoker, alcoholic, whether the patient is alcoholic or not, or a smoker or not. These factors directly influence the diagnostics and the treatment decision in the hospital. Such as information is always written in discrete manner rather than in a visual, so I have followed the same clinical reporting style. Next, my dashboard includes a detailed block showing multiple clinical conditions and lab parameters such as anemia, chest pain, cardiogenic shock, creatine levels, glucose level, heart failure indicators, and infections. I have intentionally I have uh, chosen a tabular numeric matrix need to display with the precision, not as a general trends. Doctors compared this value one by one and then interpreting through the shapes or a color. So I have designed this part to resemble the real electronic medical records. The discharge note summarize the doctor's final comments, the patient current status, and follow up advice. This part is kept in a large format because discharge notes are meant to be read clearly without any clutter. Similarly, the treatment summary presents the procedures done, lab test performed, and follow up duration in a structured table. This gives a complete one-page clinical summary, make it easy for any doctor or researcher or administrator to review the case. I also want to justify why I have not chosen the pie charts, bar charts, or the line chart, or any other graphical visuals on the dashboards. Pie charts are usually showing the proportions out of a whole. However, in a patient case file, the data is not a percentage or a distribution based age, creatine levels, glucose values, or diagnostics outcomes cannot be meaningfully represented as a slice or a pie. Bar charts are typically used to compare categories or compare multiple patients, but this dashboard is focused on a single patient, so the bar chart would not add any analytical value and would make the report look unnecessarily complex. Line charts are meant for trends over time, such as sugar readings over weeks and monthly checkup trends. In this case, I have the only one episode of admission and discharge, not the continuous time series, so using the line chart would misrepresent the data. Therefore, instead of using these chart types, I focused on structured text boards and tables. This ensured that the dashboard looks like a formal medical document, not an analytical BI report. In healthcare, clarity and accuracy are the more important than colorful visualization. My design choice supports fast clinical interpretation, readability, and professional medical reporting standards. In conclusion, this dashboard created created to represent a real world patient case file in an organization digital format. It prioritizes clarity, precision, ensuring that reviewer immediately understands patient's history, diagnostics, treatments, and discharge summary. Also, if I click to these numbers, this is the patient's admission number. So there are more numbers. So here, as I click on these numbers, there are different patient name and their history, which the doctor can easily go through it. While in paper manner, it is more difficult and it is not appropriate for doctor to go one by one. But in this format, he just needs to click on the admission number, and here he will get all the details of the patient just by the one click. Thank you so much.